Now the next thing is movements of mandible. So what are the movements which are occurring at the temporomandibular joint? So what are the movements possible at the temporomandibular joint? When we open the mouth, actually we are depressing the mandible. So mandible is moving down. So this is the downward movement or depression of the mandible. As we close the mouth, it is the upward movement of the mandible. So it is elevation. So depression, elevation. Then we can move the jaw anteriorly. So this is called protraction, and we can move the same thing back to the normal position, that is retraction and side to side movements. Okay. So depression, that is opening of mouth, elevation, that is closing of mouth, anterior movement, that is protraction, posterior movement, that is retraction, and the side to side movements. So these are the movements which are occurring at the temporomandibular joint. So mainly we have to make these movements for mastication, for chewing movements. Hence it is called, so the muscles which are involved in these type of movements are called muscles of mastication. So muscles of mastication are the muscles which are actually controlling the temporomandibular joint. So again, muscles of mastication alone can be asked as a short note, a 5 marks or 3 marks question. So when you study about the temporomandibular joint, you please study in detail about the muscles of mastication.